I'm Margarita Knox. I was born and raised a Chicago native. I love Chicago. Right around the time Obama got into the White House, I went to Florida, had my daughter down in Florida, came back to Chicago, and then moved to New York. Was out there for about 4.5, maybe 5 years. And now I am back home in Chicago. I've been back for about 2 years, and things have been interesting for sure. Domestic violence happened, I want to say about 6 years ago. I was pregnant at the time. I had 5 blows to the head, a concussion. I was pushed into 3 different parts of the house into the wall. So I had a back injury that I didn't know about, and I had a black eye. The black eye was from here to here. I was held in the house against my will for 2 days. A lot of people don't understand what we're facing. The assumption is that you've been homeless or you're gonna be homeless again, or there's this history of instability, but they don't know the reasons behind that. Some of the agencies contribute to that in terms of the perpetuation of it. When you get into, I call it the social service system in terms of dealing with social service agencies, the homeless shelters, the mental health centers, there is that mindset to where you made a bad choice, this is your bed, you have to lay in it. There was no emphasis on jobs. There was no emphasis on education. There was no emphasis on getting a better paying job. There was no emphasis on childcare. One woman laughed at me and said, okay, good luck. Your son doesn't have milk, good luck. Here's a 6 or 7 page form, good luck. There's nothing we can do for you. And one lady just told me flat out, I just put your case down and I honestly forgot. Anybody who's been through domestic violence or something horrific like that will tell you it's not that easy to just go from, hey, I've been beaten, I lost everything, to we're gonna go back to just basically everything being normal. It doesn't work like that. We were in a shelter, and I knew instantly that my daughter would be starting pre-K. We needed a primary care provider, primary care physician, eye, dental, all of that. She was gonna be needing physicals to start school. So the shelter was like literally 3 blocks from here. And I'm like, all right, cool, I'll give it a try. Initially, it started off as far as just us receiving basic services in terms of just physical and medical care. So when I became pregnant with my son Kyle here, I noticed that they had offered a lot of other resources in terms of breastfeeding, behavioral health in terms of dealing with individuals who may have suffered from depression. I'm high blood pressure, pre-diabetic, so again, they educated me a lot about that. Proper dieting, eating, exercise, and then the advocacy part.
When I think about Margarita, I think about her having a voice. She advocated for herself. That's what I like to see in our patients here, is wanting to do something, having that drive and having that courage to say, I need support. I need your help to get to where I need to go.
Our Community Action Network and through our Westside Healthy Start case managers have identified out of 398 women on their caseload, 137 of them are either homeless or considered in transitional housing. That means that from night to night, they may not know where they're gonna sleep. One thing that we've identified is not having a stable place to stay really can affect that birth outcome for these mothers that we work with. We really need to start identifying where do we send them to? What type of services are out there in the community for them to have? I think what I like about our Community Action Network is because the very referral resources that we send them to, we're asking them to come share at this combined table so that if there's a gap in what we're providing, we can sort of look at that and see ways in which we can turn that around for our families that we're serving.
We try to target those who are in need of the different resources that we can offer to decrease some of the stress and also depression that they may be going through due to those extraneous circumstances, such as the homelessness, such as the unemployment rate, such as not having the education to actually reach out to those different resources. We look at where they have been, we make sure that they're involved in the community, and then we provide those different resources.
It gave me hope. It took me out of that routine in terms of just waking up, figuring out where we're gonna live, where we're gonna get our next box of food. I didn't just need physicals to get the security job or vision to get a new pair of glasses. I needed therapy to cope with what was going on. I can honestly say they care here at Access. They give you options to help you make decisions about your health. Even though Chicago's resources aren't perfect, I can honestly say since coming to Access, we've been stable. I could have went anywhere in the medical district, but I came to Access, and we're staying at Access.
We treat our patients like they are a family that we sit at home with, have dinner with. And that loving, caring heart that we have for our patients, they in turn bring that out to the community. And with the word of mouth, we're able to bring more people into our center.
I also want them to take that very same message back into the communities where we are. Access has always been representative of community. By having some of our patients participate in that and giving them a voice and empowering them, well, it empowers us in the work that we do.
On a normal day, obviously I'm up 5, 6 o'clock in the morning with my daughter and my son. I'm getting her ready for school, I'm getting him up, I'm having a cup of tea, a cup of coffee, making breakfast. We're out of the door and on the bus by 7:45. Then I take her to school, and then I'm off either to the library. I'm filling out job applications through Indeed, Monster, whatever position I qualify to do, from security to basic medical assisting work in terms of drawing blood. Sometimes it's okay to say I need help and I don't know what to do. Speak up and be firm in what it is that you need for your family and for yourself. Speak up.
She's encouraging others with the knowledge that she has. She is a walking purple binder. We actually care about what happens to her, and showing her how to take that passion and share that with those stakeholders who can help make decisions that can impact not just her life, but other people's lives. And she wants to be, that lightning rod, and more power to her.
I can see her doing greater things for not only herself, but the community. The community is where she needs to be that face. And I believe that with that peer-to-peer interaction, she'll make a difference through other people's lives.
Break that cycle. Forget the welfare. If you have that program, you have that resume, don't be afraid or be limited by what the workforce center or the welfare office is telling you that you can or can't do. Do what you have to do to survive, but at the same time, if you want more, don't get comfortable. I'm very uncomfortable, and I like it because it's pushing me. And this program is pushing me, and my children are pushing me, and I think that's what it should be about.